So when bad things happen in Washington, D.C., we're it. MedStar's it. We're here for the citizens of Washington, D.C. and the greater D.C. area. I'm Dr. Trankiem. I'm a trauma surgeon at MedStar Washington Hospital Center. One of the things I really love about trauma surgery is I come to work and I'm never exactly sure how my day's gonna go. I might have certain things planned, meetings, etc. But if that pager goes off and they call a code yellow, all bets are off, because that's where our attention goes. In trauma, we have a critically injured patient come in, kind of like a black box, if you will, and we as a team have to figure out what's going on, what's threatening the patient's life, and work to save that patient together. And one of the things that makes the trauma program at MedStar Washington Hospital Center unique is that, unlike a lot of other places, when you come in as a trauma patient, you're going to be treated by a surgeon who also is board certified in surgical critical care. This adds an added level of expertise to the person who's taking care of you or your loved one when you're brought to MedStar. The MedStar Transport program is integral to the safety and well-being of folks who live in Washington, D.C., Northern Virginia, and Maryland. We'll oftentimes get a call at the trauma center that there's a patient at another hospital who needs to come to us right away. And because of our helicopters with our critical care nurses on board, those patients can be transported quickly and safely to MedStar to receive definitive care with us. If you really look at what we do when we take care of trauma patients, we're helping people when they're at their sickest and their most vulnerable. We address the injuries of their bodies, but we also really take care to make sure that the families and the patients understand what's going on with them. And we know that in trauma, it's not just a physical injury. There's a lot of emotional scarring as well, and we try to help them move through that. Sometimes these patients have been in the surgical intensive care unit for a prolonged period of time, on the ventilator with a breathing tube, unable to speak. And one of my favorite things as a trauma surgeon is to hear their voice for the first time. I think that's really meaningful to me.